You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. Today's a special edition, and we're going to take you through the process today. And with us, we have probably the busiest implant dentist in all of San Diego. With us, we have we've had him on the program before, Dr. Christopher Henninger. Dr. Henninger, welcome back to the program.
Thank you.
Now, you brought a stack of photos.
I did. I'm super excited about it.
And when did you started, I interviewed you, what, like 10 years ago?
Yeah, I think we've done 4 or 5 versions of this show, and the first one was about 10 years ago, yeah.
What's changed, like in 10 years, for people, like what's changed in implant dentistry?
Yeah, so I was thinking on the way here, you know, how we did it 10 years ago and how we do it now. And the workflow is entirely different. We were in an analog world back then, and now...
What do you mean? What do you mean?
So we were taking GUI impressions, and there were a lot more visits back then. And now we're in a totally digital workflow, and we're leveraging technology like we haven't been able to do before. And the reason I like that is because, for 2 reasons. It makes it more comfortable for patients, and it makes the workflow a lot quicker.
So workflow, and I asked you in the green room, I said, how many visits in a perfect world can you get somebody with an upper and lower set of teeth that don't come out? You said 2 visits.
Yeah. So
really?
Yeah, and we're not including the visit, the consult visit in that.
Okay.
So the most important visit to me is us getting to know each other. I'm really passionate about knowing where people are coming from so that I can serve them in the best way possible. And everybody really has a story about, you know, how they got to where they are, and you know why their life isn't the way they want it to be. And I'm really interested in that story, because if I can get that out of people, I feel like we can work towards a goal of who you want to be.
What do they like more, the way it looks or what they can eat?
And that's the thing about this. It's different for everybody. You know, some people, you know, they have trouble with the way they look. Some people, they're hiding the fact that they can't eat. I have a really good story about a patient who I always think about her when I come on the show, because she told me, she's like, she really liked going out to eat with, you know, her friends and her family, but she couldn't eat. Like, she literally couldn't eat. She was that disabled. And so she would remove herself from the eating part of going out to eat. Like, she would literally go out to her car, you know, and eat, and then come back for the sociability of it. And I mean, that just changed my life forever, because she was altering her lifestyle, and not the best person that she wanted to be, you know, just because she couldn't eat. And to get her back into a position to where she could eat and do what she wanted to do was life-changing for her. But some people, it's just being able to eat. Like my grandfather, we've talked about him before. You know, that guy loves eating more than breathing.
Okay.
And getting him back to eating was really important to him. But just like my friend who couldn't go to restaurants anymore, she just didn't want to look the way she looked, and changing her appearance was really important to her. You brought up your dad.
Yeah.
What was important to him? Playing the trumpet.
He wanted to play the trumpet.
Right?
So, I mean, he wore a denture for 40 years and was very resistant.
Yeah.
And now he has upper and lower teeth that don't come out.
So he experienced a unique transition, because he went from traditional dentures to snap-in dentures, and that made his life a lot better. He was able to play his trumpet the way he wanted to with his snap-in dentures, because the teeth didn't move around. They were attached to him. But when we changed him from snap-in teeth to permanent teeth, all he cared about was, could he still play his trumpet? And we've talked about this story before, and it makes us both laugh, but you know, the final try-in for his teeth, if you'll remember, I said, Joe, go get your trumpet. I want to make sure you can do what you need to do with your trumpet.
I remember that. That's
and he was
right.
like, I forgot it. I'm like, Joe, you forgot your trumpet? And he's like, I got to go back and get it. I'm like, Joe, you live 30, 40 miles from my office. Like, that's going to take over an hour or so. And he's like, no, I have to.
So he drove there. It takes him an hour and 15 minutes to get there.
Yes.
Back and forth.
He came back, and he made sure that with the prototype teeth that we had put in his mouth, that he could play his notes. Like, I think he even had a lesson that day.
Yeah.
And that he was teaching somebody. And he just wanted to make sure he could play his trumpet.
That's nice.
That was his, you know, I call it personal motivator. Like, I really want to know what people's personal motivator is, so that I can help them be the best version of themselves.
Are you ever on a consult and people have their hard luck story, you know? Do you ever get excited, like you're going, boy, they just think it's new teeth?
Yeah.
It's more than that.
So some of my assistants have been with me about 10 years, like as long as we've been doing this show. And the way I have it set up, that I like to meet people. I like to have my assistant and then the patient and myself kind of all in a row talking as a group. And sometimes when we hear these stories, my assistant and I will lock eyes and just know that this is a person that we can help.
Like, this is gonna be good.
Yeah, this is gonna be really good. This is a story. We know where the story starts. We know where it ends, even though the patient doesn't know where it ends. And we just kind of get this tickle in our belly, about how we can, help this person.
And look, at the top of the show, I said you're one of the busiest, most experienced guys in San Diego, probably one of the most, experienced guys here in California. So 2 visits. Somebody watching this, they're 2 to 3 visits away from getting a brand new upper and lower set of teeth.
Yeah, we do. After I meet you and we realize that we're a good fit for each other, and I can help you with what you need. I do want to make sure that I can help you with what you need, because if you need something I can't do, I want to make sure you get in a place where you can get what you need. I do teeth. That's all I do. I'm in the business of making people healthier, but the way we achieve that is through a healthier mouth. I only treat people that need dental implants. And my patients they come in probably 3 different categories. People who are just missing 1 or 2 teeth and just need something replaced. And I still do fix people's teeth, but it's kind of like the smile makeover type stuff. I don't do general dentistry anymore.
You have another dentist in the office that does those kind of things.
Yeah.
So you just focus on implants.
Yeah. So we do single tooth replacements, and then we help people with loose fitting dentures. So by adding implants to a loose fitting denture, it stabilizes the denture becomes attached to the patient, and it doesn't move around anymore. And that's a life-changing thing for a denture wearer. And then I'm really looking for people who are sort of in this broken state that just don't know what to do with their mouths.
And you say even with bad gums, like really bad gums, you could do this.
Yeah. So this last patient that I meet very frequently, that typically will see our show, they've lost faith in going to the dentist. And typical dental experiences, you go every 6 months to have your teeth cleaned, and some people have bad gums, like you talked about, and they need gum surgery and gum treatment, root canals, crowns, things like that. And their experiences with the dentist have been, they've come in, they're told what's wrong with them, and here's how to fix it. And it's generally not a pleasant experience, and people do it because they have to do it. But the people I'm meeting have gotten tired of that system, and they don't know what to do anymore.
Nice.
And so they've kind of dropped out of going to the dentist on a regular basis, and really, like we talk about this a lot, they've lost hope in dentistry. And what this show over the years has done for my office is let people know that there is still hope. Like, no matter where you're coming from, I guarantee you there's hope.
That's nice.
We've been able, and I'm so excited about like showing some of my.
I know you have a stack of photos, so
Yeah.
we'll make sure to get to as many of those as possible.
But these were people who didn't know what to do with their mouths, and they were some of my extreme situations that thought there was no hope for them except to extract their teeth, and by gosh, some of these people were going to do anything to stay out of dentures. They just wouldn't go there, and we're able. I never say no is one of my life mantras, and I don't like people telling me no, and I don't like saying no to people. Not everybody does this kind of dentistry, Randy.
Yeah.
And I really do. If you can't tell by now, I really enjoy the transformations that we've been able to make for some of our patients. Typical general dentists do crowns and fillings and cleanings and things like that. They don't get a lot of hugs and a lot of,
like, this is the most rewarding kind of dentistry.
I personally get a lot of satisfaction out of doing this kind of dentistry.
How much is experience, and we're really short on time, but experience, okay? Mm-hmm. How important, because a lot of people doing dental implants now. Yeah. You see them all over TV, you see ads online. Experience. Why is it so important?
Randy, experience is in doing the dentistry is one of the most important parts of this. 10 years ago when we first started doing this dentistry, we've come a long way, and the technology is a huge piece in doing this. Getting from start to finish in 2 or 3 visits, it takes...
It's almost unheard of, by the way.
Yeah, and it is a small miracle, but it takes a lot of experience and technology to be able to do that.
When did you get your rhythm? After 5 years, you think?
I don't know. We've done a lot of cases. We've done probably 1,000 arches, I think, by now, and I think I made the shift when I started worrying less about the dentistry and more about, is this the right patient for us?
That's nice. Okay,
Yeah.
good.
And so there's two things that are really important to me: is can we meet the need of, whatever your need is? And the answer is always yes. We can find a way to do that. But it's more important to me that you're comfortable in our office. If you're there's not many offices that do this and do it right, but I want you to be comfortable and you need to be comfortable in our office for this to be successful. So it's really important that you talked about doing this and skipping the consult and things like that. That's why the consult's really important for me, is so that I can get to know you and
Good.
you can get to know us too, and make sure you're comfortable here. This is going to be a life-changing thing for you. And I want you to be comfortable with the people you're working with, and I want you to be comfortable that we have the technology to get it right.
Very nice.
And
very nice.
we have a lot of experience in doing this. I'm not perfect every time though, but I will guarantee you that we will get this right for you. And if we have some hiccups along the way, chances are it's not the first time that I've
You're
seen.
going to work with you. Good, good. We have to bring this up because we get questions about price all the time. Costs. Now we should mention, even the best dental insurance does not cover this. Maybe max pay out $1,000, $1,500. Medicaid for sure doesn't cover it. Medicare, you're able to you work with them, right?
Yes, we do.
And you'll try to get some money out of there.
Yes.
But you say people finance this.
Yeah, Randy, this is another important factor in getting people the treatment that they need, is finding a way to make this happen for people. Most of our patients, all of these people we talked about today, are of modest means. And this was really important to them, to get back being the best version of themselves, and so that they could be healthy again. And so we had to find a way to finance this for all of these patients. And so we do have some creative financial options in our office. I'm really proud of them, quite honestly, because I wouldn't get to tell you these stories about our patients if we didn't help with that side of things too. And so yes, we are one of the only Medicare certified providers. So if you have Medicare as one of your benefits, it's a little tricky with dentistry because they don't cover dentistry, but they do cover some medically necessary oral surgery.
Okay.
And some of this does fit into that category. So in order to know, you have to come in and let us take a look and see what you need and see what kind of coverages you have. But we do have some creative financing options.
Okay.
And there's something out there for everybody. I want you to hear that. I really do.
Good. Good.
I don't pigeonhole people into something that they may or may not be able to afford. I like giving people options. I'm really passionate about giving people options, like in 3 different price points.
Oh, that's nice.
Yeah, it is. And so that you can make a decision that you're comfortable with. And I've done a lot of these cases, so I can help you. I can tell you the benefits and the pros and the cons of each option. And I enjoy talking to people about that. But I have a team in place that is really good about how to figuring out how to fit this into your financial lifestyle. Again, you don't know what you don't know sometimes.
Everyone seems to, nobody says, I shouldn't have spent the money on that, right?
All of these patients would spend that money again if they knew, how they were going to be at the end.
So it's that big of a deal.
Yeah, and I keep saying this, but I'm in the business of making you the best version of you.
Could you address this? Because you say most of these people saw you on TV and they waited years in many cases. What's something they ask on every consult after they've seen the interview, but they're still skeptical? Maybe you could answer that question right now.
Yeah, so some people do think it's too late, or they're not a candidate, or they've waited too long. And it is true, the longer you wait, the harder the case becomes. And sometimes also the more costly it becomes. But I would encourage you just not to wait. There's knowing is half the battle. And just come and meet us and figure out what your options are. If saving your teeth is an option for you, believe me, there's nothing better than what you do. Yeah, there's nothing better than what God gave you. And if we can save your teeth, like Lauren, we saved half of her teeth. I think it's important that we try to do that.
Good for you. Excellent. And so what's the best way? They go to your website, make an appointment, or they just call your office and make an appointment?
It's best if you call the office. Okay. Again, I have people that want to get to know you, and I want to get to know you, and over the phone is the best way to do that. You can find out some information about our office that you could see on our website. I think that's a good place to get started. You'll find out if we do the dentistry that you're interested in. But give us a call. I'd love to sit down with you, and I meet a lot of hopeless people, and there's hope out there. There's a way to.
So they feel there's no hope.
Yeah, and that's the part that really breaks my heart, really, is I do meet a lot of hopeless people, and you know, I feel like my job is to give people hope again about having a healthier mouth.
All right.
And you know, whether it be the trumpet, whether it be eating, whether it be smiling, like those are things that I want to get you back to being.
Okay, good. I want to thank you for coming on the show. Yeah. Great stuff, Dr. Henninger.
Appreciate it.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.